What a wonderful start to this session's discussion. Hello, everyone, and thank you for joining us. Today, we're delighted to welcome you to the launch of the One Health Approach for Action Against Neglected Tropical Diseases 2021 to 2030, a companion document to the now familiar NTD Roadmap 2021 to 2030. Now, as you well know, NTDs cause hardship and harm to over 1 billion people worldwide, often the most vulnerable. Now, One Health positions itself as a critical strategy to not only address emerging and re-emerging zoonotic public health threats, such as SARS, Middle East respiratory syndrome, and so on, but also environmental issues. One Health has also prominently earned its place in several global commitments and political declarations, including the Sustainable Development Goals, international health regulations, global health security agenda, the UN Paris Agreement on climate change, and the UN Political Declaration on antimicrobial resistance. Now, I'm Patricia Amira, your moderator, and before we begin, a brief mention of a few pointers that will help the session run as smoothly as possible. There will be simultaneous interpretation in French, English, Spanish, and from English to Russian. This feature is located at the bottom of your Zoom page. Click Interpretation and select the language of your choice. Speakers, kindly ensure that interpretation is turned off when you're contributing to the discussion to avoid any feedback or disruptive echoes. I'd also like to mention that this webinar will be live streamed, so your participation will be understood as consent. And for the facilitated discussion, attendees can post their questions on the Zoom chat. We hope to have a very lively discussion that will no doubt contribute to effectual social media posts. Kindly use the following hashtags: NTD Roadmap 2030, Beat NTDs, and do tag WHO, and of course, hashtag One Health as well. Okay, we'll begin by setting the scene. Now, joining me for this conversation are Bernadette Abella-Ritter, who's from the Department for the Control of Neglected Tropical Diseases at WHO headquarters, and Wendy Harrison, Executive Director for the Schistosomiasis Control Foundation based in London. Welcome to you both. And by way of introduction to the concept of One Health, there really isn't a shortage of experts, people who understand the environment and what's required. And you've got the tools. What more do you think is needed for sustainable impact?
We need to start to learn how to implement those tools and how to build the networks and the communication across the sectors in order to see who has the comparative advantage and how can we put those building blocks together to make a bigger whole with a joint impact and a bigger impact, and probably save money doing so.
Saving money is always good. Wendy.
Yeah, of course, absolutely agree. And you're of course so right that we do have a lot of expertise and a number of tools. But I think the key thing is really that those experts in the different disciplines can really only achieve that sustainable impact if they can work together to collaborate and coordinate. And actually that is not totally straightforward. And I always remember Margaret Chan saying that everyone wants to coordinate, but nobody wants to be coordinated. And so I think by creating a framework with the opportunity to actually be able to identify what are the shared goals from all these different sectors and really be able to find that common ground. This is one of the key sort of ways that we can really get that more sustained impact. And the document that we're talking about today really does take a really important sort of catalytic step in being able to kind of frame the way that we all collaborate. And again, as you say, the number of tools that we have there, also how to maximize the use of those.
And, you're talking about coordination there, Wendy. NTDs, it's 20 disease groups, and it can seem so overwhelming a task to initiate and sustain like a cross-sectoral approach, essential to achieving targets. So this better and stronger together makes sense here, doesn't it? And within that, of course, is a message of prioritization for ministries of health.
Beyond ministries of health, in fact, it's beyond. Yes. So there's actually identifying the opportunities and finding a starting point. It doesn't have to be everything at once. In fact, everything at once might be sort of scary for policymakers, and might not be feasible from the available resources. So really trying to find that opportunity, build the capacity, build the capabilities, those connections, learn how to communicate across those sectors. Mm-hmm. We have different languages, and then build that momentum to move forward.
Wendy.
And yeah, absolutely agree. And I think obviously prioritization is absolutely key. But I also think there's kind of an opportunity to perhaps slightly change our viewpoint, because within the NTD community, exactly as you say, there are 20 diseases, and it's kind of evolved that we have a group of people with disease-specific expertises, we're now starting to look at where are the co-endemicities between the diseases, which is really important. But I think that what we might need to do is actually take a completely different perspective. So perhaps, for instance, if you think about, through a more veterinary public health kind of lens, and if you start looking at the host species, so you say, for example, dogs. So through a single intervention targeting dogs, you can vaccinate the dogs and for control of rabies. You can at the same time deworm the dogs, which is obviously going to help with the control of guanococcus. And then you can put on insecticidal collars that are going to prevent sandflies and the transmission of leishmaniasis. So you're starting to sort of regroup those sort of slightly daunting 20 diseases into interventions and very sort of pragmatic approaches that really do have these sustained impacts.
And I guess, I imagine that it would be all about ministries of health and understanding what will change for the better within their own health systems, in terms of the bigger picture, for them to focus on, so that, they can get motivated to actually, adopt and adapt their interventions. What else is also needed, do you think?
There needs to be a little bit more equitable distribution of resources, so that we are preventing at source rather than treating the problem. I think that is also in line with the Sustainable Development Goals. And so convincing beyond the ministries, but perhaps supra-ministerial and other investors, that preventing at source will save money down the line in, for example, the health systems, will actually earn money because you have healthier animals, and you can sell the eggs and the milk and the meat. And so there are multiple outcomes from looking at more equitable distribution of resources and preventing at source.
Anything to add there, Wendy?
Yeah, well, yeah, I mean, obviously that's kind of all absolutely right. And I think that sort of leadership and long-term sort of vision that's needed to really affect the changes, as Bernadette said, is required, at all the different levels. And there's lots of kind of regional and national sort of excellent examples. For example, the One Health Zoonotic Disease Unit in Kenya, where, again, people have brought together the ministries of veterinary medicine, health, also environment, and importantly, wildlife, kind of under a kind of secretariat. And that, again, is really showing, real sort of leadership. But I also think that there's something around sometimes just the power of one, and sometimes just a champion an individual even or a small group that can really affect change. And again, there's brilliant examples kind of globally of how, really motivated individuals, have really been able to affect significant change by really sort of working very hard, with their colleagues in other ministries to really understand, what are their motivations, what are their agendas, and really sort of bring everyone together. So it really is at all kind of levels, but I also think that personally we can all really kind of affect change as well.
Yeah, better, stronger together. But I'm just going to go back to something that Bernadette has mentioned twice, and that's funding. But there's a problem with funding, isn't there? It's proven problematic. Funding flows are an issue, budget sharing across ministries, all of that. How do you think we can get past that, or at least support ministries of health?
I think we have to just make the case. We have to show with evidence, with data, what the benefits are, and there are bigger benefits, not just money benefits, but also global good benefits that we all share. It's a paradigm shift. It will take time. We have to be patient. We have to start and learn as we go, and make incremental changes as we move along. I think that is so. For funding, I work in a very, let's say, resource constrained setting, but that has also made us creative. It has made us creative in ways of pulling and pooling resources from so many different stakeholders to keep at least a slow but steady step to trying to achieve impact.
Wendy.
Yeah, absolutely. And, of course, I think we all recognise that sort of funding is such a powerful driver of how interventions are implemented, but also they're a huge driver of power imbalance. And so, I think it's obviously very clear, as Bernadette said, we need these kind of longer term funding streams that are able to support across sectors and are really embedded in local systems. But I think it also really underlines the need probably for a paradigm shift, not only in the funding of One Health, but also in the way that we fund kind of NTDs, more broadly. And really, if we are going to catalyse, one of the very key paradigm shifts of the roadmap around country ownership, which is of course so important for any kind of sustainable change, I really think we're going to have to take quite a hard look at the way our funding flows currently are, and how we can ensure that really aligns with the country's and the community's priorities.
Thank you both. I mean, purely for because of time, I will continue hearing your compelling perspectives, but I know that they will certainly feed into the deep dive sessions that are lined up. So thank you both. Bernadette, it would be good at this stage to get an overview, kind of highlighting the key elements of the One Health approach and why it's so critical for NTDs as a whole.
Thank you. And while we're waiting for the slides, just firstly would like to thank everyone who has contributed to creating this framework that seeks to unlock opportunities for One Health in NTDs. It is based on the needs that you helped us identify. And again, thanks to you all and to the drafting team. Wendy's group, the NNN Working Group on One Health, was part of the drafting team. Wendy, Yale, and Gabby, thank you very much. And of course, on our side, multiple people, especially Joss Kessels and Catherine Bote. So I will try to unpack some of the principles laid out. And I think we've talked about them already in this little chit chat we've had before. It's really trying to explore and identify areas of priority and opportunity, then to start and expand as we go based on the capability and capacity that is built, the relationships and the momentum. So next slide, please. And we will have some really great speakers from around the world that will show us how they are unlocking opportunities for One Health in NTD. I won't go through the program in detail. Patricia has done that, showed that already, but we will look forward to the lovely presentations that we are about to hear. So you are familiar with the NDD Roadmap, but I will just go over this very briefly. These are diseases, ancient diseases of poverty that cause hardship among the most demarginalized and vulnerable groups of society. It is about trying to unlock global progress towards sustainable development, but also towards improved equity. And so it sets out the targets that we are trying to achieve as a community and using One Health as an approach to a more sustainable achievement of those goals. And it sets out the key actions across the different stakeholders, countries, the international organizations, non-state actors to achieve those roadmap targets as a team, looking at it from the One Health angle. And recently, the FAO, OIE, UNEP, and WHO endorsed the One Health definition that is really about integrated and unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. And it recognizes that their health is closely linked and interdependent, and it needs an approach that mobilizes multiple sectors, disciplines, and communities in varying ways of society to work together to foster well-being and tackle threats to health and ecosystems, while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. Examples actually bring to life the concept, and I think it makes it more tangible. We can look at, for example, zoonosis, which was brought up in our little discussion prior to this presentation. If we look at, for example, rabies, a disease that affects dogs and humans, vaccinating dogs stops deaths in humans. Dog populations are affected by the food in the environment. But going beyond that, for example, deforestation and urbanization changes habitats. And so we have seen over the last years, and then dengue and chikungunya, for example, vector-borne diseases, becoming endemic in cities. There are also ways to look at improving systems, food safety and water safety systems and measures, and looking at also seeing how to perhaps combine or improve testing of human and animal environmental samples to increase coverage and impact by connecting the dots across the different sectors. I guess being aware of these relationships and where they fit within that system as a whole also helps us to see where is that common ground where we can start to address health risks as a community in a cross-cutting approach. And in this way, One Health is key to actually sustainably addressing NTDs and trying to prevent rather than treat by addressing the source. And this in turn helps strengthening health systems, reducing duplication, delivering sustainable gains, and of course, hopefully also save on cost. And we put up an example here about, cost effectiveness. When you look at the investment of Asia and South America, more or less the investment in a rabies program was about the same. Asia chose to put it more into post-exposure prophylaxis, that's post-bite treatment after a dog bite. And the Americas chose to put their investment more into the prevention, being in vaccination of dogs, and less needed in the human health sector. And as you see in the outcome, the Americas were more successful in reducing rabies in the human population through their animal health interventions, much better than Asia. Good. Let's move on to the next slide, please. So as Wendy just mentioned, we all have a role to play. It's about us as individuals, but us as a community to make that paradigm shift. And to do this, we need a common ground between the sectors and the stakeholders to identify what are the incentives that will bring us together to collaborate, what are our comparative advantages to add up those actions across the sectors to have a joint and more impactful result. We can try to integrate as best we can across the sectors. It could be at a unstructured level, unstructured links. It could start that way, more coordinated policies, but it could go to fully integrated programs. It doesn't make sense everywhere to integrate everything everywhere, but we can see where those opportunities are. We can start. We can start anywhere, actually, at any time and look for those opportunities to do that start. So the One Health companion document aims to offer sort of the key actions that the stakeholders need in countries and the international organizations and the non-state actors to achieve those roadmap targets. So it introduces the One Health as an approach and why it's essential. And this will be applicable across not only NTDs, but other health risks. It identifies those key actions. It provides guidance on how to support that paradigm shift. And it also brings out those big challenges that often come out when we start to do work. How we can overcome them. How do we make the bridge to build that capacity and capability in the different sectors, build that workforce, reconcile those conflicting systems and get started and incentivize collaboration. So it outlines really the next steps to operationalize the guidance. And so for that, there are different players, as we said, and we can start with the countries. Countries will look at identifying and prioritizing opportunities where One Health makes sense. They would need to develop costed plans and start to implement them. We also always encourage putting communities at the center, getting these different sectors to work together, and sustainably leading and resourcing the action. So, and building that engagement among the stakeholders. And then, of course, there are the international organizations, as you saw in one of my previous slides. You know, the international organizations are coming together to try to really build that leadership and advocacy towards One Health in a very much all of society approach. And to build those guidance and tools to support the countries and communities to operationalize One Health. And then for the other big group that supports One Health, it's around the non-state actors, those like NGOs, academia, industry. And it's about advocating and building awareness for One Health, coordinating the stakeholders, building those new relationships, conducting research, sharing knowledge, and making the products available. And all this, the document also provides guidance to program managers, and it highlights really the cross-cutting challenges and key resources needed to really start to address the 3 pillars of the neglected tropical diseases roadmap in order to accelerate progress, work in a cross-cutting way, and build that ownership. So really the next steps, at least as we see it from WHO, in order to support the momentum and the move towards One Health in NTDs, is really to look at enhancing One Health capacities, to strengthen health systems, and health systems being larger than human health systems, to facilitate the One Health work. We need a competent workforce that also will fulfill needs in times of emergencies. Workforces are reprogrammed often. We've seen that with COVID. Strengthening national and regional global surveillance. We need data to understand where to start, what we are doing, how can we improve for early warning and response. The other area is to really support countries to help build national plans, budgeted national plans, and start work. And also start to help implementing the One Health approaches in their everyday health risk management. And of course, one big area is really trying to build that and increase the political commitment and investment to One Health in NTDs and beyond. And with that, I think gives you a sort of a flavor of where we would like to take this work with you. And as a question to the large audience that we have today, I guess, what is it? What would it take to drive One Health action for NTDs in your context would be the question I would ask. And if you've noticed, there's Harry Potter in this last slide, which sort of slipped our attention until the last minute. There is no wizardry in One Health. It's the T-shirt of the little boy.
So is. Thank you so much, Bernadette. And you're right. I mean, the interest in One Health is incredible. There's, 712 attendees and growing. So thank you for that. And of course, the call to action there. So as we go through the themed speaker sessions, the question for stakeholders to keep in mind is, where can you begin, given your particular area of interest? So first, we'll get to hear from Onyeka Erobu, who's a senior advisor for health based in Freetown, Sierra Leone. Onyeka, welcome.
Thank you so much, Patricia. It's a pleasure to be here. I'm going to be talking about the context in Freetown and how we're implementing our One Health approach in relation to controlling and eliminating neglected tropical diseases. First of all, I'll be giving a brief overview of our context, and then I'll move to how we have been able to build and harness political will. I'll talk about our challenges, how we have prioritized the entities to focus on, and I will talk about what has worked well and what lessons are there to learn. As we all know, Africa bears the highest burden of NTDs worldwide. In Sierra Leone, some of the endemic neglected tropical diseases include onchocerciasis, rabies, lymphatic filariasis, soil-transmitted helminthiasis, rabies, to mention a few. We have 14 districts in Sierra Leone, and almost all districts in Sierra Leone are endemic for at least two of the neglected tropical diseases that I've mentioned, and rural and remote areas bear a disproportionate burden of these diseases. It's important to mention that over the past couple of years, we have had anthropological factors like rapid urbanization and deforestation affect how diseases are distributed within Sierra Leone. In Freetown, for example, we have seen a proliferation of informal settlements that are characterized by poor access to water, poor sanitation and hygiene infrastructure. And we have seen a lot more people being predisposed to schistosomiasis and soil-transmitted helminthiasis. Sierra Leone's population is just a little bit over 7 million people. An estimated 43% of this country's population live below the poverty line. And it's important to know that poverty in Sierra Leone has a strong spatial component, with approximately 60% of the rural population living in poverty compared to 20% in urban areas. The National Neglected Tropical Diseases Program was implemented in 2007. This predates, even the adoption and institutionalization of One Health approach in Sierra Leone. It's also been integrated into the primary healthcare, into our primary healthcare system, and this is characterized by active community participation. Now, I must mention that One Health is not a novel concept in Sierra Leone. And this makes sense when you think about the fact that we actually went through the 2014 to 2016 Ebola outbreak. There were many lessons to learn, one of which increased government's political commitment to focusing on the One Health approach as a means to strengthen resilience to health threats. Following the crisis, the National One Health platform was established in 2019, and this was also followed by the development of the National Strategic Plan for One Health. Now, our emphasis is on how to integrate the One Health approach into the way we address neglected tropical diseases. Now, one may ask, how have we been able to build or even harness political will to address NTDs through a One Health approach? As previously stated, the Ebola outbreak catalyzed the adoption and institutionalization of the One Health approach in Sierra Leone. However, we continue to harness political will to address NTDs through a One Health approach in the way we frame NTDs. What have we focused on now? We frame NTDs not only as a health agenda, but also as a development agenda. As we know, NTDs cut across all sustainable development goals. The fact that it cuts across the sustainable development goals highlights the critical role of a multi-sectoral transdisciplinary approach to addressing the issue. We have found that the moment we tell government that, this is going to help drive our development agenda, their ears are tuned to what we have to say. We also continue to spotlight success stories from within our country to sustain momentum. For example, the One Health approach has resulted in the near elimination of lymphatic filariasis. We are continuing to recover from the COVID-19 pandemic, and we see the benefits of actually adopting this One Health approach in the way the pandemic was managed and the outcomes. But it's not only important to focus on high-level political stakeholders. We also have to focus on communities. At the community level, the Freetown City Council has engaged and continues to engage and have several sensitization sessions with ward councillors. They are, of course, elected. We must get their political buy-in. And the focus really has been on making them understand the human, animal, environmental health linkages. And also we have focused on establishing a 360 degrees feedback mechanism, because we know from practice and experience that communities know what they need and many times are able to prefer the solutions that work for them. Now, I must mention that NTDs program management is predominantly centralized. This has restricted our involvement as a local council and also has restricted our decision-making capacities as local governments. However, as Bernadette mentioned, we are doing the little we can, the best way we can, with the limited resources at our disposal. I want to highlight one of the ways that we have done this. In 2021, the Freetown City Council worked with the Commonwealth Local Government Forum to identify priority diseases in Freetown. One of the concerns raised during this interaction was the free roaming dog population in the city. Now, if anyone has been to Freetown, you can tell that we have a significant proportion of free roaming dogs. What happened after this was a series of events that have resulted in funding being secured to roll out a pilot multi-sectoral rabies control strategy. We did this not by ourselves, but also with support from the WHO, the Frederick Loeffler Institute, and Ocean Partnership. What does this strategy look like? It comprises mass dog vaccination against rabies, community awareness campaigns, humane dog population management, but we are not stopping there. We are also identifying these dogs, treating them for skin infections, deworming them as a way to also deal with the prevailing animal health issues that we face as a city. This approach is aligned with the global strategic plan to eliminate human deaths from dog-mediated rabies by 2030. Political will is very important, to driving progress with One Health. Why is this so? Political will is essential because it will facilitate ownership at every level of government, be it national or subnational. And we need ownership to drive success and sustainability of the One Health approach to addressing NTDs. During the course of our work using One Health approach, one may ask, what has worked well? I'm going to link this to the rollout of the rabies, the multi-sectoral rabies control strategy I mentioned earlier. For starters, I had mentioned that we already have in place the National One Health platform. Under the National One Health platform is the One Health Technical Committee. For us, this was a good entry point into liaising with various stakeholders and sectors, ministries, departments, agencies. And the One Health Technical Committee has also proven to be a good focal point for coordination. We also started stakeholder mapping very early in the process. And stakeholder mapping was specific to the NTD we were addressing, which in this case is rabies. As a result of commencing this process early enough, we were able to key into varying degrees of technical expertise, knowledge, and experience. But more importantly, we were able to identify new actors that we could collaborate with.
That's brilliant. Onyeka, I'm going to have to interject. We'll just jump in there, just purely because of a matter of time. But you brought up some really important in-country action points that you've mentioned, and we really appreciate that. And of course, that one about doing the best you can with limited resources is just excellent. There was a comment from Sarah Cleveland. There is no magic, involved in One Health. There's so many potential benefits. We have to start taking action. So sorry to cut you off there, Onyeka, but you can come back when we get some questions for you, because already there are some. Now, as mentioned previously. You're welcome. Now, as I mentioned previously, where a shift in thinking is yet to occur, funding flows have proved problematic, especially when state actors feel overwhelmed by all that's needed to get done in adopting a multi-sectoral approach, critical to achieving the One Health and, of course, the NTD targets. Now, with us to talk through financing to support sustainable change, we have Frank Bertha, who's a senior livestock specialist at the World Bank based in Washington, D.C. If you can, keep it to 6 minutes. Thank you.
Thank you, Patricia, and thank you so much. I mean, it's a real pleasure to be with you all today. Let me start maybe by talking a bit about the World Bank and our twin goals. Our twin goals of ending extreme poverty and boosting shared prosperity. I think that it's important to understand that when we talk about neglected tropical diseases, when we talk about those diseases that affect the world's poorest people, they are really core to those twin goals of the bank, because those NTDs, they impair development, human development, sustainable development, and they trap the poor in this cycle of poverty and diseases. What we do is really to provide an array of financial products and technical assistance to low and middle income countries to help them to design and share innovative knowledge and solutions to the challenges they face. And clearly, we see today that those neglected tropical diseases are part of that of those challenges. Looking in the past, I think we may want to remember a good story, and this story is the one of river blindness and this joint program that was set up, that was put together by WHO and the World Bank. I'm talking about the 70s, and this is for me before even the One Health concept was coined. This is to me a wonderful example of joint effort, of joint actions where we combined financing with the public health interventions and environmental interventions with a lot of success. Success also in the past when we had to respond to avian influenza, and now we are in the 2000s, where the bank again with the technical partners, and that time we had WHO, but also FAO and OIE, other members of the tripartite alliance, to work together on this challenge of infection at the human-animal interfaces. So we have, I would say we have good historical records, and Onyeka mentioned the Ebola outbreak in West Africa, and this is probably the most recent response of the bank to this type of challenge by establishing a regional program around West Africa and now Central Africa to improve surveillance capacity in human populations, but also animal populations. So we have success, but we have also to overcome major challenges, and those challenges that we see, and some of them have been already identified today, are probably five in my list. First one is we've talked about the cost, but also the benefits, and far too often we're limited in the way we think cost and benefits. The One Health approach takes its full magnitude when you think across the entire society, and then the benefits are phenomenal compared to the cost of investment. So we really need to change the scale of assessing cost and benefits. Another challenge is probably a lack of champions. I mean, we need people to take the flag and bear that flag, but we need also a broader community around them to carry the efforts. We have an issue with competition between financing, and it goes back to my first point. Probably we need to convince the line ministers that in fact they're not competing, they're helping each other, and it's a real national investment that they're doing. Of course, the coordination issue is important, and again, Onyeka gave us a fantastic example of establishing a platform that is a place where the different sectors will come and discuss and find solutions and discuss those solutions. And finally, it's the continuous focus on those issues. I mean, far too often we are distracted by other outbreaks, by other events in our lives, and what we describe as this cycle of panic and neglect. What we've seen in the past is that once the crisis is gone, we move to something else, and we need to stay focused. Let me go through a few financing models that I think are relevant for our conversation today. It is difficult to find projects that would specifically invest nowadays in neglected tropical diseases, and probably the word neglected is an important one. But there's a lot of investments that we're doing with countries, where countries really have actions that may move the needle on NTDs. So I would like to think in terms of NTD sensitive investments when we think in terms of access to clean water and sanitation programs, prevention of infection control, and so forth. I'll give you two examples, very concrete examples. One is in Vietnam, where we worked with the government to invest in good animal husbandry practices on farms. So we were targeting small-scale farming, medium-scale farming, and how we could improve the quality of the farming practices, and how the farmers would understand issues around hygiene for example, a huge impact on food safety, a huge impact on public health. And in a way, I think it tells us we need to demedicalize the issue of NTDs. And I've heard this morning bringing sustainable development as a core element against NTDs, and I think this is very true. Another example that I have in mind is the one of this regional program in West and Central Africa, REDICE. So we established that post-Ebola, and Onyeka already mentioned some very relevant elements. The one that is key to me is these coordination mechanisms that we establish in the different countries. Some countries, they like sometimes to say platform, sometimes it's committee. We are soft and we talk about mechanism, coordination mechanism. It is critically important. The other thing is that we managed to, I think, brand One Health, brand those programs in a way where we maintain the attention and continuous attention, and we see the benefits of those programs. And if you look at the response of a country like Nigeria against Lassa fever outbreaks, I mean, we can see that there is a clear good benefits. Lassa is not a neglected tropical disease, but from Onyeka, we had also good practical examples. Let me finish maybe by a bit of good news. I've talked a lot about the past. I've talked about specific projects and programs which may make you think that it's a touch and go approach, and it's not. I think that it's worth mentioning that one of our main mechanisms to finance countries is the International Development Association, IDA, and IDA is entering its new cycle, IDA 20, and I think that it's very important to realize that the IDA 20 has a specific commitment on One Health. There's a commitment of the bank and IDA to support countries in developing projects and programs on One Health, and it's a huge financing package. It's $93 billion, and of course One Health will be one part of that, but this is really our collective responsibility to make the best of this opportunity. And I think that the work starts with our conversations with countries, our capacity to draw the attention on this connection between sustainable development and NTDs, the need to invest in One Health, and the building the capacity in countries. So thank you again, Patricia, and I will stop there to leave time for questions, hopefully good interaction. Thanks.
Okay, thank you very much, Frank. And yes, we'll go straight into some of those questions. We only have about 6 or 7 minutes. So Onyeka, a question for you here. Political commitment is step one for implementing One Health in any country. Individuals and NGOs can only put so much effort to a limit. How can we support countries to commit?
Well, I would want to highlight 2 things. First of all, when we talk about political commitment, there are certain things that we need to remember. There is a place for advocacy. There is a place for social mobilization, more importantly. In terms of advocacy, it needs to be continuous. It needs to be strategic. So while government at every level is doing what it can, we do have actors like the NGOs, the CSOs, even the international stakeholders that need to keep pushing this. We need to leverage policy windows and create moments that will sustain commitment and momentum. We have the World NTDs Day, we have the World Rabies Day, we've had the Interministerial Conference on Health and Environment. These are the places where Sierra Leone as a country and stakeholders have come to say, you know what, we must continue to focus on addressing NTDs using a One Health approach. Again, as I mentioned earlier, NTDs cut across all SDGs, meaning that if we're able to deal with this, then we are, dealing with poverty, we're dealing with inequalities and all of that. Thank you.
Yeah, and you're so right. Going back to Frank's point about branding One Health, which I think is crucial. Okay, so Frank, question for you. What is your suggestion to involve private companies with transparency and technical knowledge sharing if possible?
Thanks a lot. This is a very important point. What we've seen in the latest crisis we've gone through is that companies are affected by the situation on the ground, and so there is a business continuity dimension for them. But I like also the idea of companies paying back, and I think this is part of the proposal of this roadmap, and for companies to understand that doing good business means also that they invest in the environment, in the social and governance dimensions of their business, and this is critically important as well. There is a lot of room for good discussions with the private sector and for those companies to understand the mutual benefits of supporting that.
Thank you, Frank. A question for you, Wendy. I think she's still online. Wendy, the network for One Health research is critical to the academic, but may not enough. I'm trying to read this in the right way. The network for One Health research is critical to the academic, but maybe not enough. Then what kind of One Health network at global level or at country level needs to be suggested or needs to be established?
Sure.
Did that make sense?
Yes, that made sense.
Okay,
that made
good.
sense to me. Thank you.
Good,
yes, I think this is a really key, obviously a very key question, because we've obviously talked a lot about the need for collaboration and setting up of these networks. But inevitably, the answer is not going to be very simple. And I think the key issue is that it's very much around context, specific networks. And, at the global level, already there are, a number of networks, within the UN agencies, the Tripartite Plus, and, many other global networks. But I think it's, again, a kind of response to need, and actually putting together networks for the sake of kind of networks, can actually be counterproductive. So I think, those networks really have to be in response to the kind of context specific needs. And again, and within the companion document, there's a lot of examples of where that has happened and actually has had really significant impact.
Thank you, Wendy. Bernadette, over to you. How can linking animal ownership and health status to human health outcomes be improved?
Starting somewhere, really. How can, if we think of the benefits, if we're talking about animal health. And the benefits they bring to the communities and to the owners and to the families. They bring food, they bring clothing, they bring security, if we're thinking about dogs, for example. So if we are investing in there, we will also have an impact on not only the health of the human being, but also an impact on livelihoods and improved standard of living. I don't know if that's answering your question.
Hopefully it is. Otherwise, it will be another question coming back at you. So I need to stop there. Unfortunately, there are so many questions, including some for surveillance and data, but of course, we'll be having a conversation, or at least a speaker in for that as well. So thank you all. And there's been some great questions. But next on the agenda, and adding to what we've just heard, we get to consider environmental interventions for vector-borne diseases. Li Qing is the Group Director at the Environmental Health Institute in Singapore. Thank you for bringing your insight to this session, and please try to keep it under 6 minutes. Thank you, Li Qing.
Okay, we'll try. Okay, it's a pleasure really for me to be here to share Singapore's experience in environmental management for the control of vector-borne diseases. So here, this is a typical picture of Singapore, taken from a high-rise home, a typical home in Singapore. And you could see the high-density, high-rise setting of housing set against a tropical climate, very hot and humid. So this all set up for very conducive environment for vector-borne diseases. So since the 1970s, we were independent. We got independent 65, and soon after that, the vector control program was set up. It was very much based on source reduction. Since then, we have seen the force of infection of dengue plunged by 10 times. Now we are just 10% of what we used to have in terms of force of infection, probability of getting dengue in Singapore. Also, we became malaria-free in 1982. However, I must say that it is not just the dengue program or the vector control program that did the job. In fact, I think a large part of it would be due to improved living condition among the population. So if, on the left side here, you could see the picture of what a housing could look like in the 1960s. Today, the infrastructure is more developed, and so the environmental sanitation has also improved. And on top of that, along that, of course, then there's pipe water, drinking water. People do not need to store water anymore. Thus, the habitats for mosquito breeding has significantly reduced. On top of that, it's waste management system. We know waste is very conducive also for breeding of vectors, and including not just mosquitoes, but even rats. So all these environmental sanitation and water management have contributed to the plunge in dengue or vector-borne diseases in Singapore. However, we are not free from dengue. We're free from malaria. We get occasional import, but dengue has been a challenge for a long time. And some of the more environmental risk factors, because dengue mosquitoes, Aedes aegypti, they are urban dwellers. They like to breed in artificial containers, man-made containers such as what you see here on the right side. So they follow human beings. And so wherever we go, whatever containers we have, they adapted to it. So they are very smart mosquito. And of course, the warm and wet climate, with the climate change, is getting warmer. So we know that with warmer climate, mosquito breed faster, and the virus also replicate faster in the mosquito. So we are all challenged by all these climatic factors as well. And aging of buildings and construction sites, these are also environmental factors, plus the managed vegetation. If you go back to the last slide, please, you see the trees that line the cities, the city. These have been shown in our study to be a risk factor for Aedes aegypti population as well. Perhaps it's a cooling effect, perhaps it's breeding habitat, but these are some of the environmental risk factor. So in Singapore, dengue control is spearheaded by the National Environment Agency, right? It's the environmental sector that is looking after dengue. So besides all these things that we have mentioned, there's little infrastructure issues that could be conducive for mosquito breeding. So we have worked on them as well. focusing very much on environmental management in Singapore to reduce the risk of dengue, to prevent dengue. So working with the building and construction authorities, for example, we have banned for new buildings to disallow the building of roof gutters. Roof gutters are known to be breeding habitats for dengue mosquito Aedes aegypti. So if you see new buildings today, have roof gutters anyway. So the next one, please. Next slide, please. The small little things, for example, what we call a bamboo pole holder. It's just a cylinder that cylinders that stick up from the building where you could put your bamboo for your laundry. The sun is good, you know, so using sun to dry your clothes is a very obvious thing here. But it was breeding mosquitoes. So we have to redesign. We work with Housing Board, Housing Development to work on a design, to design away habitats. Aircon tray, these are some of the other examples. For example, aircon trays have to be removed, and even gully traps redesigned to have covers on them so that the mosquitoes don't fly in. Next, please. And moving forward, we are also working on Project Wolbachia, using Wolbachia mosquitoes, Wolbachia Aedes, to further suppress the mosquito population in Singapore. This is the suppression method. When a male Wolbachia is released, male Wolbachia Aedes is released, they mate to the female and they're not compatible. So the progenies do not survive. There's no progenies. And when you release enough, there will be a reduction in mosquito population in the community. So this is the eraser effect that we get in 2 towns. In fact, we have in 4 towns now. These are just examples how with the release of the mosquitoes, of the male mosquito, significantly suppressed Aedes aegypti in the population. So as what Frank has just said, you know, Frank that said that about the de-medicalized NTD, and this is really one area where environmental and looking at mosquitoes, or environmental addressing risk factors for mosquito, environmental risk factors such as mosquito would help in reducing dengue transmission. Next is also looking at the environmental risk, which is the Aedes aegypti. Previously, we have always used dengue cases as an alert system. So if you have yellow, you've got 2 or 9 cases in that community. We have put up banners telling the community that we have cases here and it's yellow. Then if you have many cases, you get the red banner. And when the cases are, the cluster is closed, when you think the transmission has stopped, you get a green banner. So, but lately we have introduced the purple banner, which addresses more looking at environmental factor than the disease itself. So we don't wait for the disease, don't wait for cluster, but address the mosquito population early on. So we've introduced this purple banner when the community has got high mosquito population. So this is derived from our more than 68,000 gravity traps deployed island-wide. Gravity trap is something that we design in-house, very cheap and cost-effective, just a cylinder with netting and sticky lining with hay infusion in it. So we just sort of deploy this all over the country to track the mosquito population. So going above, rather than just looking at diseases, we go backward to look at environmental risk factors. So all these is part of our effort in getting a greener version for vector control in Singapore. This is the whole vector control program. At the bottom of it, I would like to emphasize on the intersectoral collaboration. I think it's in sustainable preventive control, which is done, the second column here, which is done on a daily basis, inter-epidemic. Do not wait for the epidemic. Using intersectoral collaboration, we have a task force that has been formed since 2005 that would address dengue issue different sectors. So including buildings, so they include Ministry of Education, Ministry of the BCA that I mentioned, town councils, and many agencies in it. So this is our first one held in 2005. Equivalent intersectoral collaboration. Another important component is actually the public.
So I need to come in here, Lee.
Yeah.
Chin. I mean, all very important points, the early, cost-effective interventions, of course, and the interdependence of things. Thank you very much. I need to stop you there so that we can also hear about surveillance, and then hopefully we can get some questions later. Now, all the sectors depend on effective surveillance systems. So let's get an in-depth understanding of this. 6 minutes long, of course, through the lens of zoonotic diseases. Harena Rasamoelina, coordinator at SEGA One Health Network in Mauritius. It's great that you could join us to shed more light on this critical component of One Health. Harena.
Thank you, Patricia. Good afternoon, everyone. Thank you for inviting me for this webinar to share the experience of the SEGA One Health Network of the Indian Ocean Commission on engaging veterinary sector to strengthen surveillance. The SEGA One Health is a regional network covering the ministries of health and livestock of the member states of the Indian Ocean Commission, which are Comoros, Madagascar, Mauritius, Seychelles, France, through La Réunion, and the technical partners in the sub-region. Next slide, please. It aims to strengthen the surveillance and responses of those member states to epidemics. It covers about 300 health professionals organized in sub-network according to 6 main key areas as shown by the figure. You have surveillance, you have field epidemic training program, vector and vector-borne disease, climate change, and then environmental health, laboratories, and surveillance at point of entries. It is coordinated by the IUC that I belong to. And the SEGA One Health Network has started since 2009, but only with the public health sector at this time. The veterinary sector joined in 2013, and we have also people from environmental sectors. Next slide, please. So let me present you some key achievements of this One Health Network. One of the main achievements is the platform itself, because this platform allows the stakeholders from different sectors and from the different countries to exchange, know each other, to collaborate, to exchange experience through regular teleconference, through different type of meeting and workshop and other activities, common activities. Then for the surveillance and the response, we have the information sharing between sectors and between countries, enhancement of surveillance systems, both for animal health and for human health, support to response for several diseases, including, among others, rabies, dengue, and chikungunya. We have this field epidemiology training program that includes vet and public health professionals. Most of the alumni have become champions for their ministries for surveillance system, and some of them recruited by international organizations like WHO. We have also support to labs and activities in terms of vector and vector-borne disease, especially for arbovirus, and also an integrated surveillance of climate-related disease and syndrome for human health and animal health. Next slide, please. Specifically about NTD, we have rabies in Madagascar. So we support the country technically and financially in terms of to accompany the country in the elimination of the disease. We support vaccination campaign. We support surveillance for both sectors, and we are implementing with the 2 ministries a national strategic plan to eliminate the rabies in the country. So we have this platform to facilitate the contact between all the stakeholders, including international organizations. We have also some activities in teniasis and cysticercosis in Madagascar. Thanks to this platform, we are involved in an operational research entitled Validation of a Scalable and Sustainable Model for Teniasolium Control Based on Vaccination of Pigs, which is a very important project, because if we validate this model, we can scale it up throughout many countries where you have this disease. And we support also surveillance of cysticercosis, mainly for veterinary sector. And we have those activities about dengue and chikungunya, mainly on surveillance, support of capacity diagnostics, and control of vectors. We are open to our NTDs depending on the need and the request of the member states and on the burden of the disease and in those countries. Next slide, please. So in terms of engaging veterinary sectors, what work well? So the platform works very well because we have people collaborating between them. Speaking the same language, we have this mutual understanding and sharing the objective and the difficulties from each sector. The common training is something very important also because people can share the contents of their specific topics and the methods also. So they learn each other from the other sectors. We have some One Health surveillance like for dengue-like syndrome. Where you can have dengue, but you can have also a disease like Rift Valley fever. We have surveillance of AMR and for rabies involving the both sectors. We have the health information sharing between sectors, which work very well also. And the most important is that we have this commitment of each sector, both at the technical and the political level, with this willingness to sustain the network. And with this platform, with this network, we have the potential for any project that need collaboration between the three sectors. Some key points for One Health, for implementation of One Health. So for our about decade of experiences in this, it is important to take into account the needs of each sector. So One Health is not limited to zoonoses. It is not that the vets supply data for surveillance of zoonoses to public health. It's not that. It is not only on antibiotic resistance also, or the interface. There is a need to reinforce the whole surveillance system for each sector, not only for zoonoses. And the zoonoses, AMR, or NTD will be kind of collateral results for the improvement of the whole surveillance system. So One Health for us is working together with both specific and common objectives for each sectors. And the very important key point is to let people know each other with meeting or with workshop, because you can build only with this, the collaboration and trust, which is the main key points to have success, and of course to maximize common activities. Thank you.
Brenna, a question for you actually, as we dive into the facilitated discussion. As they are most likely to be the first to spot disease in domestic animals and wildlife, how can we ensure communities are involved in surveillance systems?
Yeah, this is our next challenge. We are facing it right now because we have the technical and political level in the network. Now we are trying to involve more the community level, and we work with the veterinary services with that, with a sensitization campaign, sensitization campaign mainly, and to ensure that people in the village community can benefit from this surveillance. If you want to get their involvement, you have to show them which kind of benefit they can have.
Mm-hmm. Thank you, Helena. A comment more on Li Qing. Great statement there. Do not wait for an outbreak to happen, but have mosquito alert mechanisms in place. And a question for you, Li Qing. How can we better bring environmental aspects into One Health approaches for NTDs?
Well, I'm not familiar with other NTDs. My experience is in dengue, and I think the importance of environment management, I think it's very obvious when it comes to mosquito control, as demonstrated. So as I mentioned just now, in Singapore, it's the Ministry of Environment that is taking care of dengue control. So we work very closely with the Ministry of Health. And I think there was a mention about modeling and using GIS system, geospatial, do that, and that incorporates all the different data, case data, mosquito data, virus data, all incorporated in. to make sense to do a risk assessment of the situation. So it is very important. And the age of buildings, as I mentioned, is a risk factor. And I feel that as more and more population get into cities, right? In fact, today, more people live in cities than in rural area. So as we move into cities, I think there must be, it's a good start when we build cities to have a think about vector-borne diseases or disease in general. How do we have a code of practice and think about dengue? I think Frank mentioned just now about sensitive, NTD sensitive, and in urban structures are very sensitive to dengue. So while we may eliminate malaria, we're going to have dengue popping up because of urban infrastructure. So as we build, we put in code of practice and to ensure that there's the housing are not built with crevices or with containers with water, places where water could collect.
Thank you so much there, Harena. Li Ching, for your response. A question here for you again, actually, has just come in. What is your thought of the importance to model, because you've just been talking about that as well, the broader effect of environmental control, alteration of animal vector population to avoid the boomerang unexpected effects on humans and animals and environmental health? So it's a bit of a mouthful of a question, but what's your response to that in less than a minute?
In modeling, is it?
Yes.
What's the question about modeling? Yes, I think it's very important because nobody has enough resources. So you need to base your intervention, your mitigation through risk assessment for high risk places. And so a good understanding of the disease is important. What are the risk factor? And you put all these things in a map. We have a map on a yearly basis, what we call a risk map, that tells us which are the high risk areas that we should focus on this year. And then we also have a temporal sort of projection that say, okay, dengue is coming, we need to ramp up on our partners, stock up on insecticides or something.
Okay.
So it's important, data analytics.
It is important, yes. Harena, a question for you. In terms of surveillance, what are the lessons learned that can be applied to current efforts around pandemic prevention, preparedness, and response?
Yeah, I think the lesson we can have is that it is better to prepare in the time of peace, to prepare to involve all the levels, communities, to prepare to have contingency plan, to have a very alert system, to get the data very early. And you have many tools for that. You have event-based surveillance, participatory surveillance, so methods for both sectors, environmental surveillance, but also use tools like ICT to enhance the transmission of data, and also this facilitate the collaboration, the communication between sectors.
Thank you very much, Harena. I'd like to bring Bernadette back on camera, if I may. There's just been such enlightening discussions and not enough time, it has to be said. I think, there's more opportunities to discuss the various aspects of One Health are certainly needed. A question for you, though. How do we make sure this report doesn't end up on a shelf?
And that is why I ended my slides with what next. And I've only highlighted the work of the international organizations because it's huge. What next? I think our main role is really to help build the capacities, build a workforce that can talk across sectors, build those relationships, at first informally, but maybe then embed them really in policy and practice. So there's a lot to be done in supporting national governments in building those plans. We are there and stand behind you. We try, as the international organizations, to march the talk and not just talk. and so to support the countries to do so, putting communities at the center. There's a lot still to be done in translating all these tools that we have. We have many tools into actual practice. That is where we stumble. In fact, is where to put all these multiple tools and theories into practice. But we know where to start, and we've heard it from all the different speakers. We need a baseline. We need to understand a minimum before we can start to act. And really, the first place is to understand who our stakeholders are around One Health with NTDs. But beyond that, One Health is looking at not only the endemic and neglected tropical diseases, but really looking also beyond that, so that we are increasing our reach to try to prevent at source and rather than treat. So we have a lot to do, and one of our greatest roles in the international organizations is, first of all, to develop research agendas that respond to the needs, not just respond to a publication, but really to respond to the needs and see how can we translate research results into practice and scale that up. And of course, a big part of what we need to do is, and we are doing, is building that political commitment, not ignoring the endemic diseases, because a lot of the media is around the epidemics, really to embed the endemic into that systematic approach and to really try to identify resources. And really part of the roadmap is about ownership in countries. There should also be country ownership in trying to address is prioritizing One Health. This is one of our roles as well, to build that political will and to also back it up with resources.
Thank you so much there, Bernadette. And I must say thank you to all our esteemed speakers who clearly laid out practical ways in which we can make great strides towards the vision inherent in the NTD 2021 to 2030 roadmap using a One Health approach. So many observations have been shared, and of course participation from attendees was great. So many comments on the chat box, which I think rapporteurs need to grab hold before we close down. So a big thank you to you all once again. Bye-bye.